I'm Dr. Holds, and welcome to the practice. I'm going to discuss the patient with a tearing complaint or wet eye. We see a large number of folks who have wet eyes. In the majority of these patients, we can quickly sort out the problem, and often with a surgical procedure or even medical treatment, resolve the tearing problem. There are, unfortunately, occasional patients who have issues that are not as amenable to treatment, and it's not as direct in terms of resolving tearing problems. We could basically look at tearing as a balance between tear production and tear drainage. Most of the patients I see with tearing problems, it's actually a defect in tear drainage. And if you envision the eye surface as a bathtub and you have a faucet pouring water in, which would be our tear production, and a drain pipe draining tears away, which would be the tear drainage system. If there's an imbalance, too much production or too little drainage, the tub could overflow and you have a tearing problem. Quite commonly in older patients, the tear duct opening, which is in the inner corner of the lower eyelid, may begin to roll outward. And that outward rolling of the tear duct opening prevents it from picking the tears up efficiently, carrying the tears away, and so you can develop a tearing problem on that basis. Sometimes also in older patients, the eyelid simply becomes so flaccid that they cannot efficiently pump tears through the tear duct system. Tear removal from the eye surface is actually an active process. Now, in very young patients and children, we can often do something as simple with a tear duct obstruction further down, essentially a drain pipe problem, as passing a probe through the tear duct. This approach usually does not work in adults who have an acquired tear duct obstruction. In those patients, we often have to perform a procedure called a dacryocystorhinostomy. I won't quiz you on that term later, but essentially what we're doing is making a bypass from the tear sac into the nose directly and bypassing the tear duct, which frequently in adults does become obstructed with age. This procedure is usually done as an outpatient under a local anesthetic with an intravenous sedative, or can be done under a general anesthetic when needed. The procedure itself usually takes about 45 minutes to perform, and it's about 95% effective in the average patient. So about 95% of patients who undergo this procedure have a marked improvement or resolution of their tearing, and no further treatments necessary. Typical follow-up would be about a week and a month after surgery. Most patients I advise to take about a week off of work because there is significant swelling and bruising. Typically there's a little bit of nosebleed or a few bloody tears. Most patients, I perform this surgery through an external incision or a small skin incision on the side of the nose. That incision typically heals quite nicely over the long run, although the first month or two there usually is a little lump on the side of the nose or raised area where the incision was made. It's very rare that this incision becomes an ongoing cosmetic concern that once a few months of healing have transpired. Potential risks or complications of this surgery, one risk we've discussed, which is about 5% of patients, it fails usually because of scar tissue formation. Most of these patients I can go back with a second procedure and reopen the tear duct. And there's an occasional patient where this simply doesn't work and we have to look for a different sort of solution to the tearing complaint. So this covers the incisional approach to tear duct surgery. And after we've examined you, if we determine that this is the appropriate technique, we'll have more time to answer your questions. Thank you.